With the new year upon us, it's no better time to be a better you, right? If you need a little help, maybe a little makeover, we brought in the experts from holiday makeovers to nutrition makeover. We have Dr. Milan Shah and Nutritionist Tuesday Ochoa from Beautologie joining us. Thank you guys so much for being on the show.
Thanks for having us.
Okay, so I know a lot of people have those, New Year's resolutions. A lot of them have to do with like working out, stuff like that. But hey, why not if you say, hey, I want like a clearer complexion, or I just want like to look brighter, or feel more refreshed. You could do that, right?
Absolutely. We get that request right before the holiday parties, Christmas parties, even New Year's parties. Patients want a little bit of a pick-me-up. They don't want the downtime, of course. And so there's a lot of things that can be done in the office with very little downtime. Things like injectable treatments, a little bit of Botox, wrinkle relaxer, maybe a little bit of plumpness in the lips. We call them, the getting mistletoe ready procedure. And so those things can be done. And if you want just a little bit of freshening up of the skin, maybe get that Christmas glow on, we have a wonderful treatment called Microneedling that helps to achieve that with, again, very little downtime.
I want to start, I think because of the way I have this laid out, we're going to get to microneedling, but the liquid facelift, that's something that kind of stuck out to me. So here's a liquid facelift. Here's a before and after picture, right?
Right.
So what is that?
So the liquid facelift is a treatment where we combine different liquids, combining things like Dysport, which is a wrinkle relaxer to kind of freshen up the eyes or go after those crow's feet for those pictures. And then using a little bit of filler like Restylane or Juvederm to give the cheeks a lifted look. And so combining these different liquids to get refreshed, rejuvenated right in the office.
Well, she looks great. Okay, so the microneedling is what you're talking about. Let's look at that. This is amazing. Here's a before and after picture. You can see just how much brighter her face is, right?
Yeah. So what microneedling is, it's a relatively new treatment. It's been out for a couple years now, but it's a device, a micro pen we call it, that has these little tiny needles that go in and out of the skin at 100 times a minute, and it's not as bad as you think it'd be. Very comfortable procedure, and what it's doing is it's breaking through some of that damaged skin, and then we're delivering a serum that's rich in growth factor deep down to the skin. And growth factor is what really rejuvenates our skin. It brings out that healthy skin that's firmer, that's tighter, that has that nice glow to it. And in office, very little downtime, a day or two of just a little bit of a flush and you're back to your regular routine.
And anyone can do it, right? Anyone can do the microneedling and everything else?
Pretty much anybody. We go through your health history, make sure there's no contraindications, but absolutely, pretty much anybody can do it.
I like it, and I like how there's not a lot of downtime. Okay, so we have this beautiful plate of superfoods Tuesday. So not only is it important, you have to be healthy inside, right?
Absolutely. Yep, it's about the outside and the inside together.
So, so talk about more how you work with patients to be healthier for the new year.
What we do is we have them come in and we set realistic expectations for them as far as what their goals are for weight loss. We design a plan where they can make subtle changes over a gradual time to let them really see the results and let them see just natural weight loss occurring without having to make these big plungent changes in their diet or in their just lifestyles.
And realistic goals, right?
And realistic
it's all
goals,
about realistic goals in the new year because you don't set those and you kind of set yourself up for failure. Right. And superfoods. So you brought superfoods. So that's an important part of it, right?
So we want to, being healthy from the inside out, we want to make sure that you're getting good superfoods that are rich in antioxidants that will not only help keep that face looking nice and glowing, but also keep that waistline nice and tight and lean. So replacing one meal a day with some superfoods like maybe a kale salad will really let you see the results in the face and in the weight as well.
Okay, and you feel good.
And you'll feel better.
Good. And speaking of feeling good, so Dr. Shah, I did a story a few months back about the IV nutrient therapy. That's another treatment that you guys offer where you get the IV.
Yeah, absolutely. And I'm so happy that you got to take advantage of it. Of course, if you could take it, ingest it, and you could change your diet to a diet like this, that's wonderful. But typically, the average American diet, we're not getting all those nutrients. We're not getting all those micronutrients that we need. And so we do have these IV cocktails that we put together that have all the essential nutrients, and we give it to you right into your bloodstream. You don't have to worry about losing that through the GI absorption, and you feel good. You feel energized. It really is all about health and energy and just kind of keep going on with life.
Yes, and you know what? It does make you feel good. We're out of time, but check out Beautologie. There's so many options. So check them out. Tuesday and Dr. Shah, thank you so much.